Hello, good evening. It says I'm live. Let me just have a look. I am live and welcome back. How are you all doing? I hope all of you are keeping safe. Uh, it's been a very, heck, very weird week, with so many negative news about COVID happening. But I guess all we have to do is take a deep breath and just pray that everything goes well and everyone is safe. So today, what am I going to talk about? I've already put it up, though, but still. So this topic is very close to my heart because there are millions of people suffering with this, and I keep getting calls to check about what can be done for this particular condition called Irritable Bowel Syndrome. Irritable Bowel Syndrome is a chronic and unpredictable condition in which the symptoms keep changing over time and it's just not the same every time. It's extremely hard to talk about it and that adds to the challenge of living with it. So IBS per se doesn't affect just the individual who suffers from it, but it also affects the entire family. It affects your friends, your patients, the doctors, and even your clients if you are working. Everyone whose lives intersect is affected by this condition. Having IBS gives you something in common with literally millions of people who live with this disorder every day. And there is no cure to it yet. There are ways in which you can manage it, though it might not be always simple and straightforward, but still it is manageable. It may take some detective work by you and your doctor before you find out what works best for you. Managing your own health is obviously important. So let's know what is this all IBS about. So the global prevalence of IBS is 11.2% and it affects women 1.5 times more than it affects men. IBS is a gastrointestinal disorder which is characterized by presence of a cluster of symptoms and signs in adults or children. And these symptoms include cramping, abdominal pain, bloating, altered bowel habits, food intolerance, just to name a few. So IBS is a functional disorder. This term refers to the changes in the functioning of the digestive system that results in the collection of symptoms referred to as IBS. What does that mean? That means that this particular problem is with the motility or the movement of the intestine rather than any damage to the tissue of your digestive system. Now, you know what IBS is. Did you know there are types of IBS? Depending on what your symptoms are, you have three basic types of irritable bowel syndrome. The first one is IBS with constipation. This comes with stomach pain and discomfort, bloating, abnormally delayed or infrequent bowel movement, and lumpy or hard stools. The second one is IBS with diarrhea. This comes with stomach pain and discomfort and an urgent need to move your bowels, abnormally frequent bowel movements, or loose or watery stools. And the third, as anyone can guess, is IBS with mixed bowel habits. People with IBS with mixed bowel habits will have constipation and diarrhea, both. So there are about an equal number of people with IBS in each category. But there is also evidence that most people with IBS will alternate between the times with both the types over the time. So this makes it very, very difficult for the researchers to find a single drug treatment that will relieve all the symptoms of IBS. So different medications work for IBS, which has constipation, and there are different drugs for diarrhea. So doctors will usually tailor an individual treatment regimen depending on what your symptoms are at that point in time. What can cause IBS? If we know the reason, probably we might just help ourselves a little. The exact cause of IBS is not known. So it's believed to be due to a lot of factors, including alteration of your gastrointestinal movement. Abnormal nervous system is another reason why this happens. There's increased sensitivity to pain and food intolerances. The risk factors, which I can probably tell you are some of them are here. A few of them I might miss, but then most of them are here. So the first one is abnormal movement of your intestines. The second is hypersensitivity to your pain because of full bowel or gas. Food sensitivities. Stomach flu or a stomach bug, as people say. Gastroenteritis, which may also trigger IBS. Psychological conditions such as anxiety or depression. Reproductive hormones or neurotransmitters may be off balance. Small intestinal bacterial overgrowth. I did a complete session on this once, so I think a lot of you would know about it. Genetics is also thought to be possible. It might cause IBS, but it's still not proven. So these are some things which can cause IBS. So how do you know that you have IBS? The first and very common symptom is pain in your abdomen. One of the most common symptoms is discomfort and pain. The second is your stomach might feel bloated. If your stomach is bloated all the time or very regularly, it might be a very strong sign of IBS. Abdominal bloating causes your midsection to feel tight and absolutely full. Your stomach might look visibly swollen. The third is gas. So IBS can cause a lot of gas or flatulence, and certain foods and beverages can make these symptoms worse, like beans, cabbage, any type of milk product, high fat food, drinks that contain caffeine, alcohol, or artificial sweeteners. Eating foods that are rich in fiber can also trigger flatulence. On the other hand, in some people, fiber can relieve some symptoms of IBS, including constipation. So if your doctor encourages you to eat more fiber, gradually increase your fiber intake. This can help lower your chances of getting bloated. The next is changes in your stool. So IBS can cause changes in your bowel habits and stool, including constipation and diarrhea. So in case you have a change in your bowel habit, that is like a red flag. You might have mucus in your stool, which is again a potential sign of IBS. So mucus is a clear liquid that protects and coats the tissues on your GI tract. With IBS, you may pass mucus in your bowel movements along with your stool, which is not good. So that is an indication, one of the indicators of IBS. So you realize that you have symptoms, you are having abdominal pain, you are having change of bowel movements. So how do you get yourself diagnosed? Honestly, there is no definitive test to diagnose IBS, unfortunately. But your doctor will ask you details of what's bothering you. They will compare that with a set of standard symptoms. To meet these symptoms, to meet these standards, your belly needs to be having this problem for at least 6 months. And in the last 6 months, you will have to notice these symptoms at least once per week. What symptoms you have to take care of? You should have 2 of these 3 symptoms. Your belly pain is related to your bowel movement. When you have pain or discomfort, your bowel movements are either more or less frequent than usual. And the third, your stools have changed in appearance. They are either harder or softer than usual. If this is what you're going through and you don't have any other red flags for another disease, like blood in your stool, unexplained weight loss, fever, your doctor may not check any further. they may be ready to diagnose you with IBS and start your treatment. But if your symptoms include diarrhea, or they have started only after you have turned 50, you might need further tests. Also, if you have a family history for stomach diseases, then the doctor would want to rule them out. So what are the red flags that the doctor looks for besides IBS? The first is onset of signs and symptoms after the age of 50, weight loss, rectal bleeding, fever, nausea, or recurrent vomiting for that matter, abdominal pain, especially if it's not related to the bowel movements, or it occurs at night, diarrhea that is persistent or awakens you from sleep, anemia related to low iron. If any of these symptoms are present, the doctor might ask you to go for colonoscopy, X-ray, CT scan, or upper endoscopy. There are certain lab tests also which might be recommended for you, like lactose intolerance test, breath test for bacterial overgrowth, and stool tests. Okay, quite a lot of tests which are there, which might be required for you to diagnose you, or rather rule out IBS, and check if there is something else which is bothering you and not IBS. So what you eat, I've always said what you eat makes a lot of difference on your symptoms. What you eat and how you eat can affect your symptoms drastically. While it may not be possible to completely eliminate or prevent IBS symptoms, but you may find some foods which trigger IBS. To help figure out which food causes you symptoms, it is advisable that you make a food diary. Some foods can help you in prevent those symptoms or IBS flare-ups. So what are those foods? First is dietary fiber supplements, water, low-fat food, high carbohydrate food, probiotics, and high fiber diet, which may relieve constipation in some cases, but it may also, worsen some symptoms like bloating. So just be careful when you are changing your diet. Just increase your fiber very, very gradually. What are the foods that you should avoid? The first culprit in this is dairy products, including milk and cheese. Lactose intolerance symptoms can be very similar to IBS symptoms. Certain vegetables like cauliflower, broccoli, cabbage, Brussels sprouts, and legumes. Fatty or fried food, alcohol, caffeine, or soda, food high in sugar, artificial sweeteners, chewing gums, and nuts. Okay, these are all about the food. Now, I come to something which is something which I actually tell about in most of my sessions: stress. So, does stress induce IBS? According to an article published in World Journal of Gastroenterology, having IBS results in imbalance between your brain and your gut. The result is that stress and anxiety sometimes triggers overactivity of your gut. This causes diarrhea and stomach churning, which is very common with people with IBS. In others, brain signals are underactive and their gut may slow down, resulting in constipation, gas, and abdominal discomfort. So yes, my friends, stress does matter and stress does create IBS. So scientifically, I'll tell you how stress affects IBS and how it might trigger IBS. So the body's goal is to maintain homeostasis, or a steady state of being. After a stress response, fluctuating hormones are meant to return to their normal levels. However, when people experience chronic stress and anxiety, their body cannot get back to normal. So this often is the case in a person with IBS. Stress can create a havoc on your gut. It causes the release of many hormones, including corticotropin releasing hormone. So this hormone is linked to the gut's healthy bacteria, which maintains bowel function. This extra factor also activates your body's immune response. While this might sound like a good thing, but immune activity has its own adverse effects, as in case when when a person has a strong allergic response to healthy food. Chronic stress can cause your intestinal bacteria to be imbalanced. So it is very, very obvious that stress can cause IBS. It causes something called a dysbiosis, and which plays a very important role in creating IBS. An estimated of 40 to 60% of those with IBS have anxiety or depression. A stress or a major life traumas like breakups, loss of a close family member, or anything that might emotionally disturb you are all known to worsen the symptoms associated with IBS. Stress can also have the following effects on the IBS. It reduces intestinal blood flow, increases intestinal permeability, activates your immune system, and causes your immune system to flare up, to get inflamed. So try to minimize. I'll not say don't take, because it is highly impossible not to get stressed at all, but try to minimize your stress as much as possible. That is going to be helpful for overall body development of yours. So, what can be done for IBS? Nearly all people with IBS can get help, but it has to be customized. One treatment is not something which will work for everyone. So many things, trigger IBS. So as I've already told you, if you actually take care of the triggers, you might be able to handle IBS much better, in a much better way as possible. A lot of times, if you are taking care of your diet, medication might not be required. So doctors use medication like bulking agents like psyllium husk, antibiotics to change the amount of bacteria in your intestines, antispasmodics, probiotics, etc. So IBS per se is a very complex, long-standing illness, which is often difficult to diagnose, and it is terrible living with it. But through a better understanding of the potential triggers, whether it is linked to your diet, lifestyle, stress, or any other factors, changes can be made and it will improve your symptoms. It will reduce the number of flare-ups that you have. So, what exactly can you do to manage your IBS? I'll tell you a couple of tips which I feel are helpful when it comes to IBS. So the first thing is try to understand what situations bring your symptoms and how do you feel at those times. Make time for meals. Sit down, relax, enjoy eating with others if possible. Avoid eating on the go. It is absolutely necessary for you to spend time to eat. Keep a food diary. Know which foods are likely to worsen your symptoms and reduce your intake of those foods. Eat 3 regular meals a day at the same time and roughly the same portion. Always leave enough time to relax on the toilet. The bowl never works under pressure. Make sure your toilet is warm and comfortable. Try to keep active. Get enough exercise. This will make you feel better and it will also help your bowels. Avoid meals that are rich in fat and restrict your intake of poorly absorbed carbohydrates. Lead a balanced life and aim to reduce stress as much as possible. Take out time for yourself and relax and do things that you enjoy doing. Go and see your doctor if you notice any blood in your stool or if you have any unplanned weight loss. So, certain foods which might trigger your IBS again are red peppers, green onions, red wine, wheat, and cow milk. So be careful, be wary, and make a diary. See, because what happens is what suits me is something which might not suit you. You know, maybe I'm allergic to milk, but probably you are pretty okay with it. There are people who are allergic to carrots, which is supposed to be healthy. But saying that, one treatment does not suit everyone, and one kind of a food doesn't suit everyone. So make your own diary, make your own plans. IBS is something which can be managed. It is something which, with diet and regular exercise, can be managed pretty well. If it is going out of your control, then please visit a doctor. They will be able to help you. Also, try meditating or going for walks. Whenever you are stressed, try going for a walk or play with your pet, or maybe go mix up with some kids and just see how your stress just vanishes. I hope I could clear a lot of doubts about IBS, and maybe the next time I would come up with something which troubles a lot of other people. I think I'll talk about migraine the next time. How many people would like to hear about migraine? Do let me know. I would love to hear your suggestions. And thank you everyone who has watched this live, and thanks to all our audience who are going to watch it again as a recorded session. It's a pleasure being here every week. Thank you, and have a lovely evening ahead. Bye-bye.